Why do 70% of healthcare professionals love these medical quizzes? Because they're both fun and informative. Let's get started. Question 1. A patient with aortic stenosis is undergoing a transcatheter aortic valve replacement. Which of the following complications is most likely to occur after the procedure? A. Stroke. B. Heart failure. C. Arrhythmia. D. Renal failure. The answer is A. Stroke. Stroke is common due to the risk of embolization of debris from the aortic valve. Question 2. A patient with chronic obstructive pulmonary disease develops Cor Pulmonale. Which clinical manifestation is common in this condition? A. Jugular venous distension. B. Peripheral edema. C. Tachypnea. D. All of the above. The answer is D. All of the above. Cor Pulmonale leads to jugular venous distension, peripheral edema, and tachypnea. Question 3. A patient with pericarditis experiences chest pain, worse, with deep inspiration, and relieved by sitting upright. This pain is known as A. Pleuritic pain. B. Anginal pain. C. Referred pain. D. Neuropathic pain. The answer is A. Pleuritic pain. It's a sharp, stabbing pain characteristic of pericarditis. Question 4. A patient with ventricular tachycardia is unresponsive and pulseless. What is the most appropriate initial intervention? A. Defibrillation. B. Cardiopulmonary resuscitation. CPR. C. Intravenous medication. D. Intubation. The answer is A. Defibrillation. It's the initial treatment for unresponsive and pulseless ventricular tachycardia. Question 5. A patient with hypertensive crisis is treated with intravenous hydralazine, which is a common side effect. A. Headache. B. Tachycardia. C. Hypotension. D. Nausea. The answer is C. Hypotension. Hydralazine can cause rapid blood pressure reduction, leading to hypotension. How did you do? Keep honing those skills, and see you in the next quiz.